The fact is the unemployment numbers were actually significantly better than the national average. We're putting people back to work. We've certainly got a ways to go, and we're going to continue to focus on that.
When we have 30,200 unemployed people, and there's another 18,000 who are underemployed, people who have taken jobs part-time, people who are working multiple jobs, people who have taken a job, they're not using their educational background or their training. The food stamp numbers show how tough the economy is. 17% of the people on food stamps. I'm glad we have unemployment programs. I'm glad we have food stamp programs. And I'm glad that we've had a number of companies that have come to Delaware. But essentially, we haven't done enough. We need to hold the rate of growth of government to no more than the rate of inflation, which means 1 or 2% a year. I don't think Jack disagrees with me on that.
Well, not only do I not disagree, but in fact, we've done it. The average growth since I took office in state spending is 1.7%. We are the only administration going all the way back to the DuPont administration where our state government headcount is lower than it was. So, I mean, we have been very focused.
Not counting teachers.
Not counting teachers. The agencies under our control within the cabinet, the 16 cabinet departments, the only administration going back all the way back to the DuPont administration. And it's not been through layoffs. It's been through a very careful management of the attrition. We've got the state police working with probation and parole officers as well as youth probation and parole officers to make sure we're focusing our attention on the most violent offenders. There's no question that public safety is a piece of it. The other important piece are some of the social issues. This is why we opened up 10 community centers across the city, the state government paid for, so that kids had a place to go. We opened the curfew center to make sure that kids, when they were out too late, had a place to go. And I believe that some of the investments we're making in places like early childhood education are going to be huge because it's going to make it more likely that these kids have a better path forward.
I understand exactly how this issue works. I know that if that armed robbery had occurred in Greenville on Jack Street, it would have been responded to much more aggressively and much more seriously by the state. It's a matter of leadership and it's a matter of making it a priority. Wilmington will not develop economically until we solve the problem of public safety.
First of all, it's offensive. It's offensive to think that you would suggest that we care less about one crime victim than another. And within days, no, let me finish. Within days of that young man being shot on East 24th Street, I knocked on the door of his mother, and I talked to her. I went to 10th and Pine, where he was shot, and talked to dozens of people out on the street to talk to them about what they were looking for and how we can help.
If I'm offended, you're offended. Because at the end of the day, what it really comes down to is assessing the problems. And if we can't have a discussion about crime in the city, and we can't have a discussion about it being treated differently in Greenville than it's treated in Wilmington, it's just a fact. It's the way it is. And so let's face it.
Are you making a case for profiling? Is that what you're saying?
No, it's not profiling at all. It's well, maybe geographic profiling, but I'll tell you, walking down the street of Newark or walking down the street of Wilmington is a different experience. And the level of policing is different.
We talked about the work the Attorney General's office is doing. We talked about the cooperation between the probation and parole officers and the state police and the youth probation and parole officers. Do you have a single idea, a single new idea?
One of those parolees robbed me. I understand exactly how that works.
You have a single suggestion?
I have a suggestion. We have to we have to do a better job with minimum mandatory sentences. We have to keep the career criminals and the people we've identified that are repeat offenders in prison and in jail. We call it the Department of Corrections, but it's really, we house a lot of these people. They're tough problems, I understand. One of the huge problems is substance abuse. We need more substance abuse programs to assist them. But at the end of the day, it's not an effective program.
Okay, so we're going to lower taxes, increase substance abuse, lower taxes, more police on the street. I mean, I would just like to understand how all this fits together, and if you have any specific ideas, and then how you're going to pay for them.
Well, we pay for them for being more efficient, and I know you're setting this up that, oh, I've done a lot and you're not doing anything, but being down there in the city of Wilmington on a daily basis, I've experienced it firsthand.
Exactly.
I have two children who recently graduated from the Brandywine school system. The Brandywine school system is about a third African-American students. A large number of those students are bused from the city to schools that are not really neighborhood schools. It's difficult. Their parents who work in the evening don't have the opportunity to be as engaged in their education as some of the parents who live right around those schools. That's a problem. Now, I'm not about racially segmenting schools by moving those schools back in the city, but we have to find a better way to engage those parents. A lot of things we have to do creatively for the students. It's a different population and there are different needs.
We are making progress in Delaware in terms of narrowing the achievement gap, and it's something that we keep a very careful eye on. As we narrow the achievement gap, we want to do it by raising the achievement of all students, and that's exactly what we're doing.
The percentage of children who graduated in June of 2012 was 47% workforce ready or college ready, which means every kid who's meeting the goal of the State Department of Education, we have a child who's not. And I would also tell you that disproportionately, African American students fall into the category of not college ready and not workforce ready. We don't have enough opportunities.
When the Affordable Care Act is implemented across the country and here in Delaware, we will address the significant majority of that issue. That being said, I think the bigger issue is we've really got to move away from what has become a sick care system, where providers get paid based on how many procedures they do, and move toward a health care system where providers get paid based on whether they keep people well at an affordable value.
When we mandate minimum benefits, we make the cost much more expensive, we make health insurance much more expensive, and we wind up covering less of the population. One of the things we should do immediately is open up purchasing of health insurance across state lines. We have a health insurance market that if it's not manufactured in Delaware, if it's manufactured in Pennsylvania or Maryland, you can't purchase it. That causes a problem and makes health insurance less affordable.
I'm not really troubled by the idea of buying across state lines. I mean, the fact is there are a lot of people in Delaware who work for companies out of state who essentially have their coverage from out-of-state providers. That's not, I mean, I think that's, certainly an idea.
We aren't good consumers, but the Affordable Care Act moves us the wrong direction.
Should we legislate information then? Because you say as long as consumers can make good.
We don't legislate information in the purchasing of an automobile. We don't legislate information in purchasing of a home. People are quite capable of making a lot of decisions for themselves.
Because companies don't take advantage of it?
Well, what happens in the healthcare industry is it's very complex, and when you are sick and you are ill and you are laying on your back in a hospital, you're not in the best position to negotiate price or negotiate care.
Or read a pamphlet.
Or read a pamphlet or do whatever else. Right. So part of this is about educating people before they go in.
The challenge is if people don't have to pay for it themselves, which is true for a lot of people depending upon their coverage, the transparency isn't sufficient. So I think really looking at the way we do this, the payment mechanism, moving away from fee-for-service is an important part of that.